We are excited to welcome in the studio Dr. Preeti Malladi. She is one of the top minimally invasive bariatric and general surgeons in the entire Dallas-Fort Worth area. Doctor, welcome to the program, and let's get right into it. Who's the perfect candidate for bariatric surgery?
Well, obesity is a spectrum, and some patients need to lose a lot of weight and some patients need to lose just a few pounds. And bariatric surgery is meant for the patient who needs to lose a lot of weight. So we measure this by body mass index, which is a combination of your weight and height. It's a formula. And we look at patients who have a body mass index over 40 or a body mass index over 35 with other obesity-related medical conditions like diabetes, high blood pressure, heart disease. So that's one way that we look at candidacy for surgery.
All right, very nice. Now I hear that possibly insurance can help out. Is that the case?
That's absolutely the case. The only thing that people need to understand is that bariatric coverage is almost like having dental coverage. You either have it or you don't. It's not under general coverage. And so if a patient doesn't have coverage, then we can work with them with financial planning. But if they have coverage, then there are certain criteria that the insurance companies require you to meet. But in our practice, we help them understand if they have coverage and also to go through all the requirements to help them get approved.
Doctor, tell us, what is the preoperative process before surgery?
Well, surgery is just a component of success for weight loss. And so we have a multidisciplinary program to help a patient look at not only their nutrition and their fitness schedule and also the psychological factors contributing to obesity so that they can look at those things and make those lifestyle modifications prior to surgery. And also they can get educated on the surgery itself and what it takes to be successful. Okay,
after surgery, take us through the post-operating program.
Well, when a patient comes to the hospital, most of the times they're in the hospital maybe 2 nights. They're up and about the evening of surgery, and they're usually off their pain medications in just a few days. They're home, and I usually tell patients to be off of work for 2 to 3 weeks while they're recuperating and also just focusing on themselves and focusing on their nutrition.
There are different types of bariatric surgeries. Can you explain what is best? How would each individual know what is best for them?
Well, the most common bariatric surgeries are the laparoscopic adjustable gastric band, the sleeve gastrectomy, and the Roux-en-Y gastric bypass. And those 3 operations have different pluses and minuses. I really encourage a patient to talk to their doctor because it's really based on the patient's medical and surgical history and some other medical conditions that they may have, because each operation affects medical conditions differently. And so I would say it needs to be a conversation with the physician involved.
Dr. Malladi, you are a minimally invasive surgeon, so what does that mean?
I actually did a fellowship in minimally invasive surgery because I wanted to make sure I could get the best outcomes for my patient. And traditional surgery requires a large incision, and sometimes that's necessary. But most of the time, we can do these operations with small incisions, anywhere from 5 to 10 millimeter incisions. And the important thing to understand is that the pain from surgery is usually from the incisions on the abdominal wall. And so when you can make them smaller, patients do much better. They have less pain, they have easier recovery, they have fewer wound issues, and then overall their recovery is better.
Excellent. Dr. Malladi, the myth is surgery is the magic bullet. Is that the case?
Well, I really want to clarify this because I think patients who aren't bariatric patients don't understand that surgery is a hard road and the patients have to do a lot of work to be successful. And these are patients who've come to me who've tried over and over with various weight loss programs to lose weight, and then they would regain weight. And they have quite a few medical conditions that they have to work against. And then they have to do significant lifestyle modification so that they can be successful with surgery. Surgery is just a tool to help them in their lifelong fight against obesity, but they do have to do a lot of work around it preoperatively and postoperatively for the rest of their lives.
Dr. Malladi, is bariatric surgery just for weight loss, or does it have other effects?
Well, most of my patients who come to see me actually come because they have other obesity-related medical conditions like diabetes, high blood pressure, sleep apnea. So they're not coming just for some cosmetic look, but they're actually wanting to get off those medications. And obesity can have a direct relationship with you having those medical conditions. So losing the weight can help with those other conditions as well.
All right, for those out there thinking, maybe I need some bariatric surgery, I may need that procedure, how do you choose the right surgeon?
That's a great question. And if I were looking for a doctor for myself, what I tend to do is, number one, I look at their training, I look at their expertise. Do they have expertise in this field? Do they have a fellowship training? Have they focused themselves in this area? Number two, it's always nice to get word of mouth. Do you know other patients or other physicians who know that doctor, and what is their reputation and what are their outcomes? Also, just going to see the doctor and talking with the doctor, getting a consultation, making sure you're comfortable with that relationship. Because with a bariatric surgeon, it is a long-term relationship. So not only do you need the technical expertise, but you also need someone who's going to be caring for you for the long run, and you'll be seeing them in follow-up. And so I think those are some of the things that you would want to look for.
So Dr. Malladi, someone comes and they have bariatric surgery with you. What are their outcomes? What can they expect to lose?
Well, it depends on the operation that they have. When you look at the gastric band, you expect to lose around 40 to 50% of your excess body weight, and that happens in a slow, steady process over 2 to 3 years. With the sleeve gastrectomy, it's anywhere between 60 to 70% of their excess body weight, and most of it happens in the first year to 18 months, and then they can progressively have a little more weight loss over a 3-year period. The gastric bypass, a little more weight loss, probably closer to 70% excess body weight loss. And this is looking at studies, looking at thousands of patients. A given individual may be more than that or a little less than that, but those are the averages.
Excellent, okay. For those out there thinking about bariatric surgery, Dr. Malladi, what is their next step? What do they need to do?
Well, I encourage a patient to call my office, and they can come in and talk to me. We can go over the different options and the program and see what's going to work for them.
For more information on Dr. Malladi and some other life-changing stories, some unbelievable video stories of Dr. Malladi, log on to bestdocsnetwork.com. That's bestdocsnetwork.com. Dr. Malladi, thank you for being on the program.
Thank you very much.